Implementing family-centered care in pediatric nursing. Introduction to family-centered care. Welcome to this video, where we explore family-centered care. What is family-centered care? It's a healthcare approach that recognizes the family as the primary source of strength and support for the child. It values the family's role in care decisions. It acknowledges that families know their children best. The core principle: collaboration between healthcare providers and families. Partnership rather than providers directing care alone. The ultimate goal: improving patient outcomes. Increasing satisfaction for families and providers. Supporting emotional well-being for the entire family. Why this matters: children heal better with family support. Families cope better when involved. Care is more culturally appropriate. Health literacy improves. The 4 core principles. Family-centered care is built on 4 foundations. Principle 1: respect and dignity. Recognizing and honoring the family's values. Respecting cultural beliefs and practices. Acknowledging parental expertise about their child. Principle 2: information sharing. Providing timely and accurate information. Presenting information in an unbiased way. Ensuring families understand their child's condition. Using language families can understand. Principle 3: participation. Encouraging family involvement in care decisions. Inviting families to participate in care activities. Supporting families to care for their child. Principle 4: collaboration. Working as a team with families. Involving families in all aspects of care planning. Respecting family input in treatment decisions. Partnering throughout the healthcare journey. Benefits for everyone. Family-centered care creates positive outcomes for all. Benefits for the child: increased emotional security and comfort. Reduced stress and anxiety. Faster recovery times. Better cooperation with treatments. Improved developmental outcomes. Benefits for the family: empowerment in their child's care. Better coping strategies. Reduced anxiety and fear about medical care. Increased confidence in caring for their child. Stronger family bonds. Benefits for healthcare providers: improved communication and trust with families. Better patient compliance. More accurate assessments. Increased job satisfaction. Better patient outcomes. The nurse's role. Nurses are central to implementing family-centered care. Key nursing roles: act as a facilitator connecting families with resources. Serve as an advocate for both child and family. Provide clear, honest communication. Involve families in care planning and implementation. Support family autonomy while ensuring evidence-based care. Additional responsibilities: recognize emotional challenges families face. Identify cultural factors affecting care. Understand financial barriers to care. Connect families with support services. Empower families through education. Building relationships. Establish trust through consistency. Show genuine care and concern. Follow through on commitments. Respect boundaries. Assessing the family. Understanding the family unit is essential. Key assessment components: family structure, who are the family members? Family dynamics, how do they interact? Cultural and religious beliefs, what values guide their decisions? Coping mechanisms, how does the family handle stress? Support systems, who helps them? Useful assessment tools. Genogram provides visual representation of family relationships. It shows multiple generations. It identifies patterns and connections. Ecomap identifies external support systems. It shows community connections. It reveals strengths and gaps in support. Why assessment matters: individualizes care. Identifies family strengths. Recognizes potential challenges. Guides intervention planning. Effective communication. Communication is the foundation of family-centered care. Active listening. Give families your full attention. Don't interrupt. Ask clarifying questions. Reflect back what you hear. Encouraging open discussion. Create a safe environment. Encourage families to ask questions. Address concerns honestly. Validate feelings. Age-appropriate explanations. Talk to children at their developmental level. Use simple words for young children. Provide more detail for adolescents. Use visual aids when helpful. Nonverbal communication. Make appropriate eye contact. Use open body language. Show empathy through facial expressions. Respect personal space. Cultural considerations. Culture shapes health beliefs and practices. Respecting cultural practices. Learn about different cultural health beliefs. Don't make assumptions based on appearance. Ask families about their preferences. Accommodate cultural practices when possible. Key areas to consider: language and communication styles, dietary restrictions and preferences, modesty and privacy needs, decision-making patterns, who makes health decisions, religious practices and rituals, views on pain and pain expression, end-of-life beliefs. Using interpreters. Always use professional interpreters. Never use family members, especially children. Allow extra time for interpreted conversations. Speak directly to the family, not the interpreter. Supporting hospitalized families. Hospitalization is stressful for the entire family. Encouraging parental presence. Welcome parents at the bedside. Provide sleeping accommodations when possible. Allow parents to participate in care activities. Respect parents' need for breaks. Providing psychosocial support. Acknowledge emotional responses. Offer counseling services. Connect families with social workers. Provide information about support groups. Comfort measures. Encourage familiar items from home. Allow family photos and decorations. Accommodate family routines when possible. Provide age-appropriate activities. Flexible visiting. Minimize restrictions on visiting hours. Allow sibling visits when appropriate. Create family spaces. Support family bonding time. Supporting siblings. Siblings are often the forgotten members of the family. Challenges siblings face: fear about their brother or sister, jealousy from reduced parental attention, guilt about staying healthy, confusion about what's happening, changes in family routine. Interventions for siblings. Provide age-appropriate education about the illness. Use simple, honest language. Answer questions truthfully. Encourage visits and interaction with the hospitalized child. Make visits positive experiences. Provide emotional support through play therapy or counseling. Maintain some normalcy in their routine, including siblings. Let them help in small ways. Acknowledge their feelings. Spend individual time with them. Celebrate their accomplishments too. Family involvement in pain management. Parents are partners in managing their child's pain. How parents can help. Providing comfort and reassurance. Using familiar comfort measures. Holding, rocking, or singing to younger children. Staying calm to help the child stay calm. Distraction techniques. Reading favorite books. Playing music. Telling stories. Using bubbles or toys. Watching videos. Advocacy role. Parents know their child's pain cues. They can alert nurses to increasing pain. They advocate for appropriate pain management. They ensure pain is reassessed after interventions. Education needs. Teach about pain scales. Explain medication options. Discuss non-pharmacological methods. Address fears about addiction. Discharge planning. Effective discharge planning begins at admission. Key components. Assess family's ability to provide home care. Teach medication administration with return demonstration. Provide symptom management education. Explain warning signs requiring medical attention. Arrange follow-up appointments before discharge. Written instructions. Use simple, clear language. Avoid medical jargon. Include visual aids when possible. Provide in family's preferred language. Include contact numbers for questions. Community support. Refer to home health services if needed. Connect with support groups. Provide information about financial assistance. Link to community resources. Addressing concerns. Allow time for questions. Have families teach back instructions. Provide written and verbal information. Schedule follow-up calls. Chronic illness impact. Chronic illness affects the entire family system. Common emotional reactions. Stress from ongoing care demands. Depression related to changed expectations. Guilt about the child's condition. Helplessness in the face of illness. Grief for the life they imagined. Financial strain. Family coping strategies. Connecting with support groups. Individual or family counseling. Spiritual guidance and practices. Respite care to prevent burnout. Maintaining routines when possible. The nursing role. Recognizing signs of family burnout. Offering interventions and resources. Validating feelings. Celebrating small victories. Providing hope while being realistic. Coordinating multidisciplinary support. Long-term support. Regular check-ins. Anticipatory guidance. Care coordination. Advocacy for services. Family advocacy. Empowering families strengthens care. Encouraging involvement. Invite families to participate in care conferences. Include families in healthcare decisions. Respect their knowledge of their child. Value their input equally with professional perspectives. Supporting family rights. Informed consent for treatments. Access to medical records. Second opinion opportunities. Privacy and confidentiality. Participation in research decisions. Policy involvement. Encourage families to advocate for policy changes. Support parent advisory councils. Include family representatives in hospital committees. Promote family-friendly healthcare policies. Empowerment through education. Teach families about their rights. Provide resources for advocacy. Support families in speaking up. Model effective advocacy. Barriers to family-centered care. Understanding barriers helps us overcome them. Common organizational barriers. Time constraints and heavy workloads. Staffing shortages. Lack of private spaces for families. Restrictive visiting policies. Insufficient training in family-centered care principles. Provider-related barriers. Traditional paternalistic attitudes. Fear of losing control. Discomfort with emotions. Communication skill gaps. Family-related barriers. Language differences. Cultural misunderstandings. Financial constraints. Transportation issues. Work schedule conflicts. Strategies to overcome barriers. Ongoing staff education on family-centered care. Policy updates to support family involvement. Use of interdisciplinary teams. Flexible scheduling. Cultural competency training. Providing interpretation services. Creative problem solving with families. Ethical considerations. Family-centered care involves complex ethical issues. Balancing parental rights and child's best interest. Respecting family decisions. Providing evidence-based recommendations. Negotiating when views differ. Involving ethics committees when needed. End-of-life care decisions. Providing compassionate communication. Supporting families through difficult decisions. Respecting cultural and religious beliefs. Ensuring child comfort. Addressing sibling needs. Confidentiality and adolescent autonomy. Respecting adolescent privacy rights. Balancing parental involvement with teen independence. Discussing consent and assent. Supporting developmentally appropriate autonomy. When families refuse treatment. Understanding their perspective. Providing thorough education. Exploring alternatives. Knowing when to involve authorities. Maintaining therapeutic relationships. Let's review the essentials of family-centered care. Key takeaways. Family-centered care improves outcomes for children and families. Families are partners, not visitors, in healthcare. Nurses play a vital role in supporting and educating families. Communication and cultural awareness are essential components. Advocacy empowers families and improves care. Overcoming barriers requires teamwork and commitment. Ethical challenges require thoughtful, compassionate approaches. Sibling and extended family needs matter too. Chronic illness impacts the entire family system. Discharge planning and follow-up support are critical. Final thoughts. Every child exists within a family context. Healing happens best when families are involved. Respecting families honors the children we serve. Your commitment to family-centered care makes a lasting difference. Thank you for watching HESI EXIT Pediatric Nursing. You now have comprehensive knowledge to provide excellent family-centered pediatric care. Best wishes in your nursing career.